fill the screen.
That.
There we go. So let me do the little intro here. I'm Teresa. I am with the Lower Columbia Canoe Club, and we started doing the safety series during the pandemic. And now that the pandemic's officially over, we're still doing it because we want to keep the conversation going about things that matter to whitewater paddlers in terms of our health and safety. And tonight, our guest is Oren Kennedy, who is someone that I have never paddled with, as far as I know, but I became aware of him because he was making intelligent posts about drownings and near drownings, and that's something we're going to talk more about in another program, on the Golly. And I started a conversation with him, and it led here. And he's going to take us through the things that he has learned the hard way about injuring your brain. And with that, Oren, you can take it away.
All right. Well, thank you. If I'm talking too low, let me know too.
You sound fine.
And if anyone wants a question answered, or just raise your hand, or Teresa, you'll tell me, I'm sure.
I'll monitor the chat.
Okay. Because I can't see that at the moment.
Mm-hmm.
My name is Oren Kennedy. This is what I wanted to cover basically tonight. A little bit of my head hit history. What is a TBI? What is CTE, which is in the news now? It's chronic traumatic encephalopathy. I'll explain what that means. It's something that happens with recurrent hits. Why kayakers should be interested in this. Helmet design, what's good, what's bad, and hopefully you'll probably not hate me too much on this part. Dealing with a TBI or stroke on the river. Risk analysis, because it might entail stuff beyond just paddling downstream. Caregivers and their role. Caregivers are a very important part of TBI recovery, and I'll give more information on that as well. Some overall risk analysis for critical thinking, basically, and what boaters can do. Oren, that's me. I'm in the tandem. My friend Doug is in the back. That's Pillow Rapid on the Golly River. That was our plan B move to side surf Pillow, and we were up there for 5 rafts to go past and 3 hard boats to go past as we were side surfing. It was very fun. My recreational history started when I was doing biking a lot. I've been bicycling, since I was 12, basically. I did long distance road stuff. I actually became a road safety instructor. Then I got involved with mountain bikes as soon as mountain bikes came out onto the scene in the late 80s. I used to race tandem mountain bike. And we did okay in the regional. After bicycling, I went into kayaking, whitewater kayaking.
Oren accidentally turned his sound off.
Sorry, Oren, I turned your sound off. I was trying to mute someone else.
Oh, thanks. I'll watch.
Can you speak up just a little bit?
I will. Yes.
Thanks.
After my bicycling, I tried kayaking at the same time. Basically, I started it when I went on a trip to Hawaii to visit my sister and tried a wave ski, and that was pretty much what got the bug onto me. I guess when I was muted, I'm a former ACA whitewater kayak instructor. And I also did river rescue. I was in some of Charlie Walbridge's and Wayne Sunmacher's early classes. So I've been doing that a while as well. About the same time I started kayaking, I started snowboarding. That was very fun. I also went through more helmets in that sport than any other, more than any other sport. I called my falls the helmet tests. That's me in a nutshell. However, as far as head hits, whoops. Okay, I'm going to give a bit more history on my head hits because I went ahead and I don't know how to go backwards. In the 1984, when I was about to graduate from college, I was playing Frisbee about 2 months before finals and fell backwards onto a light post. It was cement. And I hit my occipital area of the brain. And it gave me a closed head skull fracture. That was my introduction to TBIs. As far as doctor integration, all they did was check for bleeds. And since I did not live in the town where I was in college, I went home and basically took care of recovery on my own. That was healthcare in the 80s. Check for bleed. If you weren't bleeding, well, there you go. Unfortunately, what I had at that part, it took me roughly 2.5 years to recover from a short-term bout of what's now called aphasia. I had aphasia for writing, where I could literally start writing a sentence, and by the end of the sentence, I would forget what I was writing about. It took me 2.5 years of going through exercises on that and a little bit of psychotherapy to understand that I was not going crazy. It was just something my brain wasn't parsing well. After the skull fracture, and I took up the kayaking and snowboarding, I had a few concussions. Nothing really, only 2 notables on kayaking. Kayaking, I didn't hit my head relatively much. I did crack a helmet at one time. That's Wisconsin for you. But snowboarding, I did not crack any helmets, but I went through a good number of them because I had, well, with snowboarding, you're going to be either dynamically falling forward or dynamically falling backwards onto your head. You're falling on either way, and both quite dynamic and fast. As far as snowboarding, I'd say I had a good 3 or 4 mid-level concussions, which basically meant I was seeing stars and I took the day off just to rest and wasn't feeling so hot afterwards. Then in 2006, I was assaulted for a guy that wanted to steal my computer that was in my hands. He didn't get it, but he did punch me in the left side mandible, resulting in a double dislocation of my jaw. So it could not move, so I didn't have to get it wired, but it did create trauma. I'll explain where the trauma took place, but that was another significant head hit. Then in 2018, I got rear-ended by a small commercial salt truck while I was at a stoplight. He hit me going about 35 miles an hour when I was at the stop. And he said 4/5 of a load of salt in the back. So it was a lot of impact. Didn't really do much immediately. We thought it was mainly going to be a whiplash, but I'll get into that more. And that I did not have many immediate symptoms. It took a long time for my symptoms to make their appearance, and also diagnosis of head injuries takes time. It just takes time. So now I'll go over what is TBI. Oh man. Oh, there it is. Cool. What is TBI? I'm going to skip back. Sorry. I just realized, okay, I'll try not to get people dizzy. A traumatic brain injury happens when there's usually some kind of concussive impact to the skull or head, any area of the head, and it's not always concussive. It can be due to motion, it can be due to whiplash, it can be done to side by a punch, or if your head gets shot, if you're doing a mini whiplash to the side, it happens because of trauma. There's some kind of trauma involved. And what it does is your brain shakes up. It messes up the connective tissue that holds it in its little liquid bath of cerebral spinal fluid, and it shakes. Your brain does not like shaking. It does not like getting concussed. Traumatic brain injuries this is common, caused by a blow to the head or being forced to move rapidly back and forward. Think of a shaken baby. If you shake a baby, there's no impact, but there's a lot of movement. So you get trauma just caused by movement of your brain wanting to stay static and getting buffeted around just because of outside forces. The brain damage, you can be torn, stretched, penetrated, bruised, swelling, can all make the injury worse. Bleeding does not have to occur, either internally or externally, but just the fact of blood in brain tissue causes a reaction because the brain neurotissue does not like blood in contact with it. Alcohol associated with up to half of the cases of TBI. Basically, when people have lower, they're not thinking straight, basically. TBIs are caused often by car accidents, falls, assaults, sporting accidents. With kayakers, that would include falls, falling on slippery rocks, falling upside down and hitting your head on something. With kayaking, it can also be if you're side surfing in a hole, your head's bobbing up and down extremely violently. Guess what? You're getting a head injury. I'll explain that one a bit more. Sorry, this is sensitive.
Yeah. You're going forward.
I'll show you, I'll explain. I use these mainly because I want to explain what went along in my head. The biggest thing I saw when I had my Frisbee accident, and this is your left side here, this is your right side here and your left side here. When I had the Frisbee accident, I impacted my head in the back. The only thing that showed up on an MRI later was what's called a lesion. It's basically a formation of scar tissues. There was a quarter-sized thing flat side to the cleft. On the inside, it was literally a quarter scar tissue, a quarter size of a quarter on the inside. On my car crash, the impact came from the back. And so what happened is it took a long time for the scars to occur. Generally, you won't see scarring in your brain until about 9 months to a year and a half after your impact. And I had to wait 3 years to get a full diagnosis of what I'm explaining now. The impact sent shock waves through my head, and you can literally see the curvature of the waves. I am now about 5 to 10% of my right frontal lobe is basically a gummy bear consistency of tissue. It's not necrotic until air hits it, so I'm okay. However, those waves came from the back, bounced forward, then they reverberated throughout all the different sides. On the side view, not only did the shock wave expand forwards, it rebounded upwards, downwards, and I'll explain the physiology later. I actually had a concussive wave that came from my small bones and went upwards into the middle of my brain. That's what the scar tissue in my head now show. I'll explain a bit more of that later. Typically, when you see a TBI, you might also see a stroke. It can occur one and the same, one after the other. If someone's kayaking and has a stroke, they'll quite likely hit their head on something too. So you should, as kayakers, you should know what a stroke is. That's going to be the most visible other than someone's brain leaking out of their helmet. Ischemic strokes are caused by a blockage of some of your blood vessels in your brain. Traveling blood clot kind of thing. That can be one of the ischemic strokes, but ischemic strokes also work on concussive, where just a concussive force can cause cells to hit together with enough force to cause a clot on their own, just by concussive impact. So you can get a blood clot just because of the concussion. The other kind of stroke is a hemorrhagic, where you have a break in a blood vessel and you have a blood leak into your brain. Blood is not kind to neurological tissue, and it causes damage just by contact, but also due to loss of oxygen. Ischemic strokes are far more common. Hemorrhagic strokes are less common, but usually more severe. If you have a person that has a hemorrhagic stroke on a river trip, you need assistance in a hospital as fast as possible. There is a drug that can help recover people from hemorrhagic strokes really well, but that has to be applied to them within 2 hours. I know under kayaking trips, that's going to be a hard thing to do. Because not even a helicopter can get you in less than 2 hours. And if you're having a stroke, you can have both of these occurring at the same time. Another thing about strokes that goes along with most TBIs is called a transient ischemic attack, TIA. These are temporary blockages that basically have a cluster party in your artery and dissolve and go away. I had those as part of my impact. I was watching for them at the time too, because these are warning signs that a larger stroke is likely to occur. So that's when in my history, I had my car accident in January. And it was 7 months later or 6 months later in July, that's 7. I don't number well, but in July, I had a TIA while I was just getting into work. I had to go to the bathroom and because I wasn't feeling right. But when I was in the bathroom, I did not know where I was other than I was in my work building. I went out into the atrium, that's a 4-way entrance into the office parts. And I had to have a coworker lead me to my office cubicle where I called and had a friend of mine, a coworker, came in just as I got to my office. And so instead of calling for an ambulance, he had his car out front and he took me right to the hospital. And that was my last day at work. TIAs are extremely common, but that's also part of just something to be aware. Okay. Now, the other part, I'm going to talk about CTE. This is not new, but it is relatively new neuroscience. You've all probably heard of the NFL doing a study on football players and concussions and long-term effects. Some of that got squelched, but it has a good history if you look on PubMed, which is a medical paper database, you can see a good history there. Other sports started to see the same thing where people with head trauma from the past in the sports were killing themselves, going through depression, killing other people, having a psychotic episode, and just doing odd behavior that was not common to those persons. This has happened in both hockey, rugby, football,
Boxing.
thank you. Also, it has happened in bobsledding, where I've been getting a lot of good stuff from bobsledding. And basically what CTE is, this is small, so I know you can't read it. I've got a link to this too, by the way, so you can look at it. It's basically they've seen that when people have repeated trauma to the head, like from boxing or with sled head, they were having a considerable percentage of people committing suicide, usually 10 years after their years in competitive bobsled or skeleton. It was beyond depression. They don't know what was happening other than they all had the same common elements of head impacts. And with bobsled, they're still studying the impacts, but it's not from people being slammed into the wall, which does stuff. It's from the repetitive motions of your neck when you're in the sled, whether you're facing down or facing up on your back on a luge. In rugby, soccer, well, there are no helmets in soccer, but rugby has started to wear better helmets. Hockey has developed better helmets. And as I've told Teresa, one of my people that worked for dental work, I'm missing up on the term misalignment of jaw. When I had my jaw injury, I was going to this one practitioner who's not also just a dentist or dental surgeon, but he was also an osteopathic doctor. He worked out a method for not just addressing jaw alignment, but actually to fix it and literally repair the alignment. My dentist, osteo person, was Dr. Gary DeStefano, and he worked with a couple professional hockey teams. They developed what they called a concussion guard. It's a very similar to a regular mouth guard, only it's modified to give you alignment and cushion, specifically in the back of your jaw, where the most force will have to be absorbed very quickly, as a means to protect the soft bones that are on the inside of your skull, coming from these angles. Okay.
There, you have a picture of the mouth guard.
Yep. Yeah. Yeah, okay. I'm going to go through a little bit of physiology thing here. Oh, good. Here's the normal brain. I was going to use this one to show also the different aspects of or views of a brain. In my TBI is what they call diffuse, which means that there's scar tissue and damage throughout all of the brain except for the brain stem and cerebellum. All of the inside with all of your small glands, your hormone and blood chemistry and all of that, your data storage, your analytic views. In my case, let's see, I already went over some of it, but remember that I said that I had in the 1980s from a skull fracture, I had a little quarter-sized scar on the right lobe cleft. Now, this portion of my brain is the jelly part. You can see the concussion waves, but also the side waves rebound, and that whole right side of the cleft is almost entirely scar tissue now in my brain. So I have a lot of aspects of split brain now. That just makes things messy unrecovered. Sorry, one more. Yeah, that's one. There's one. What I want to explain, I'm going fast, I think.
That's okay.
I do not have a clock in front of me either, so sorry.
Doesn't matter. Just
What
go
I
at
would-
your own speed.
Okay. Most people, when they're thinking head injury, think, oh, just a glancing blow or something hitting the head. And most people think only about what's covering your brain on this side or the round from the top. But in this area here, right next to your mandible, which is here, there's a lot of small bones that are behind your nasal passages and your ocular nerves. This is when you have a blow to the head and your head falls back and forth, your jaw, which has extremely strong musculature, will literally snap back into these small bones with enough force to cause a concussive injury. The bad side of this is that this is all where your pineal, your hormone balancing,
Your pituitary and your hypothalamus.
your sight, your nasal passages, and your hearing all get controlled in this portion of your brain. So that's why, another reason why I have what is called aphasia. Aphasia is a communication disorder where I am actually quite fluent until you put blinky lights behind me when I will lock up and I cannot talk. The words do not, the words will be in my head and I cannot say anything. As I get tired, it also gets worse, and I slur like I am now. But aphasia that I had from the skull injury was from writing. This time it included my vision. My vision degraded. My reading ability went way down. I thought I was going to lose it. And coming from me, that I used to read about 6 books per week, speed read kind of thing. I would just suck them up. And since the accident, I've been able with my practice now has gotten me up to about 2 books a year through reading. So that's a drastic cutback. It also takes me a lot longer time and I have less comprehension, which is something I actually quit work because I did not want to lose the ability to read. When I had to choose on going back to work or not, they said, well, you're gonna mess up your therapy if you go back to work. And I'm like, okay, that's it. I want to be able to read. So luckily I've gone through a lot of vision therapy, but I just got tinnitus last year, so I'm expecting to probably get an ear check sometime this year too. I've seen an endocrinologist for one of my current therapies, but yeah, my pituitary has gone wacko. My thyroid has gone wacko. And yeah, all of these little bits, just due to swinging your head a lot. If you have a heavy whiplash injury, can cause this kind of damage. Oh yes, another thing to be aware of is that a lot of if you're a kayaker and you're saying, okay, I got a helmet, I'm covered. Yes, but one thing it will not help with is what's called subconcussions, which is another aspect of that repeated head movements. If you look at any of the links I've posted on the sled head recovery, there's some very good ones I posted. I'll share the links with everyone. It goes over a lot of the repetitiveness of injuries and how it's not just head trauma, which a helmet would protect at, but it's a lot of the short, quick, sharp movements with high Gs in bobsled, which really seem to be the driver in that sport. And I've been thinking now that just because you have a helmet, don't think that that's going to keep you covered. As one guy at a neurologist I was talking to at a brain conference that was local, I asked him about CTE, and he gave a presentation on boxing and CTE about how it modified behaviors. And I'm going, well, I've been a whitewater kayaker and I've got high probability of it. And I actually have an MRI that shows lesions in my brain. And I jokingly at that time said, I haven't decided on whether to give it up. And then he looked at me and said, the thing you have to absolutely understand is a helmet does not prevent a TBI. The helmet cannot make it so you will not have a TBI. There's no helmet that does that. No matter what helmet you get, you'll have it. You can get a TBI. So don't think that you're impermeable when you're kayaking and have that expensive helmet. All the helmet will do is decrease some of the damage. So you have a decreasing device. And one thing with subconcussions is subconcussions hit the small movements of the axis atlas back here. So you'll get a lot of rattling in this direction. And if you're on a side surf, how many of us have gone out for that side surf and the wave is up to our shoulder and you go up on top of the thing and then fall back down into the trough. You go up and fall. And it gets wearing just because you're doing this constant, literally 2-foot fall. It's usually pretty forcible and quick. But when you think on the force, this jaw is getting a workout because it's trying to, if you're wearing nose plugs, you're trying to breathe through your mouth. And it's trying to stay open a little bit so you can breathe better, but you're doing the bouncy and clacking your jaw, which means you're basically injuring your head without hitting it, is what I want to say. Same thing for this area of your neck. One thing that my osteopathic doctor really has noticed through my kayaking career is my neck wants to go straight. I've always had treatment from her to get it to keep this normal curve, which is what a neck looks like in relaxation. Most of us that have to drive a long while and kayak a lot will have what's a neck that literally straightens out. And which in a bad way, that means you're less able to take the stresses of that bouncy over time. Most people will see slight ruptures along their neck cartilage at that point too. I'm not getting checked for that because I don't want to know. One thing I do is add an extra layer of protection when I go biking now, or kayaking, which I don't now, or snowboarding, which I don't, but I used this while I was snowboarding for the last 10 years or so. And this is not your traditional horseshoe mouth guard. It won't show here. This fits on your lower jaw, and it's built up on the back towards where your jaw first wants to connect with your back teeth. It's got cushioning and alignment built in. Here's the extra cushion you can see. The front is cut away. You can get a blow to the teeth and this will not protect your teeth. However, with this guard on, your jaw will have like this rubber stuff so it doesn't clack. It's also thin enough that you can talk normally. I can talk pretty much normal right now. It's just lower. But you can also drink while you have this on. Coffee turns it brown. And it makes it look pretty disgusting. This is not brown. It's normally quite clear. But it's cut away in the front so you can talk relatively normal. And there are, the one that the hockey players use is very similar to this. So the ones that actually get in the brawls, they'll have these in. Even though it doesn't look at and their teeth might be broken and bleeding up front, that's because they're using one of these. My dentist that fabricates these, they make them off an impression. So they're about a $50 mouth guard. Most dentists now know how to make these because they have the equipment. Once you do a mouth impression, to be able to make these. They're not your typical kind of guards. They are specifically for concussion protection. If you're going through braces, you have to get extra width for that. But these add a second layer of protection so that you're not just counting on one device for helping your head. You're acting on two. And the same thing, I use this when I'm biking or when I was snowboarding. this really, really, really helped when I was snowboarding for impact protection. Any questions? Okay.
I actually have one. Can you tell us what a subconcussion is? Is it just like not quite to, is it like a subclinical thing or?
A subconcussion is just something that you've like a whiplash kind of movement,
Mhm.
um, where it's just quick and short, sort of like the TIAs are quick and short. um, when Corin gave his description on going over waterfalls when he was giving his speech, you'll remember that he was analyzing whether it was good to go at a 30-degree angle or if you go flat. But he said if you mess that angle up, you get a little bit of a whiplash just from going down wrong.
Uh-huh.
That would be a subconcussion due to the head and neck movement.
Okay.
The subconcussions are quite big in the sport of the sledding sports. That's
Mhm.
where you'll see more addressing of these subconcussions than you do in rugby, but just due to the physics of the thing, they're probably pretty common in rugby, impact sports, and they even say use these guards for mountain biking or road biking, which I use, but I know, okay, I know zero people other than me that use this for snowboarding. I was the only person I know, even when I boated with some other dentists, which may be on this group, to wear one. It's very not common at all to use a mouth guard when you're kayaking.
No, I don't know of anyone that does it. Do you want me to do that slide that was up? This
Which
one?
one? Oh, not yet.
Okay.
Um, no, not many people use the mouth guard, which is discouraging to me because don't think of your head as relying on one piece of equipment. In our safe, whitewater people are probably the most safety-minded sport that I've ever belonged to. But if you're thinking everyone works through their safety mentality as a layer as onion layers. You
Mm.
want extra layers of protection. Most people kayaking, snowboarding, whatever, they use a helmet, and it's like, wouldn't you use something else on it if you could, as an extra layer? And this mouth guard that I have basically costs $50, and it's well worth it. Um, let's see. Um, yeah, this is what we were going to go on. Did you want to do this one, the head hit on the river?
I can. I mean, I put most of it in there. If you want me to, I will.
Okay with it? And I'll go. You can
Okay,
explain, but I'll add anything that I want. Yeah, go
that's
for it.
great. Well, I mean, I'm sure you've all read this quote at the top here, and what my friend Scott Gerber said about how hard it is to assess is really true. And it's mostly because we're in such a hurry to go downstream that somebody flips over and they get hit pretty hard and they roll up and they're like, I'm fine. That's what they say. I'm okay. I'm okay. And I've done it too, many times. And sometimes they're not okay. And we need to take enough time to know if they really are okay or not. And so the very first step when someone takes a head hit is to stop the group, to actually get people to stop, get out of their boats, and take a real break. And then you start your assessment process on the patient themselves. And the first thing is to just talk to them. Medical people will know to ask the 4 questions, which would be, what's your name? Where are you? What day is it? And what just happened? And then you ask them those same questions again later. to see if they're getting better or worse, because if they forget their name, it's getting worse. Yeah, I saw in the chat someone said, look at their pupils. That's part of a basic neurologic exam. It's a lot of the same stuff that you would look at to see if a person was having a stroke. Can they smile? Is their smile lopsided? Ask them to lift their arms. Do they lift both their arms the same, or is one up and one down? Have them grab your hands or your fingers and squeeze. Are their grips the same? All of these things will tell you if a person is having a stroke, and they'll also help with assessment of any kind of a brain injury. But probably more, go ahead.
Well, another one that happens about 50% of the time in my experience is that the face will slump.
Mm-hmm.
You won't be symmetrical from each side. Something, your eye or your jaw or both, will droop.
Hmm.
They might have hearing only through one ear. They might have sight blank out on one eye, which is very freaky, but it happens both with stroke and TBI.
Yeah.
And you're absolutely right. It needs time. Don't be in such a hurry to get down that if a person's done anything to cause an instant headache or something's not right, you can take 15 out of any kind of trip unless you're in a race. And okay, I'm not a racer head.
And what you were saying about the asymmetry of the face, that's where the smile and stick out your tongue come in, because a person, if you ask them to smile and their smile doesn't look right, or they stick out their tongue and it's going to one side, that's a bad sign.
Other one that the first responders don't use, but I would add.
What's that?
When you're asking your questions, ask something involving numbers, because especially with me, my aphasia, I cannot hardly do arithmetic at all. And numbers is another thing, just as much as you'll see for arm strength. Say count backwards from 100. If it can, to this day, I already know that if I get pulled over, I'll fail any drunk test if they ask me that. It's quite common for a head impact numbering is something that's also immediately an indicator. And you can add that to your quiver.
Yeah. So the last bullet point in the first section, how to assess if it's severe, get an ample history. Ample is a nice way of remembering some important things that emergency personnel will want to know. So if they're going downhill and they're still conscious, get this information. Find out if they're allergic to anything, especially medication, if they're on any medications, if they've had a previous similar injury. When was the last time they ate, and what did they eat, and what happened? And if you can get the ample history, those 5 questions answered, and get it written down on a scrap of paper and hand it to the EMTs or paramedics, they will be very grateful.
Or if my method was to take a Sharpie marker, and if I need to, I'll write on that person. So that I don't usually carry a piece of paper, but I'll carry a Sharpie in my first aid kit, and any exposed skin is game for writing your notes.
Right. Yeah. Allergic to. Very useful. So the decision whether or not to walk out, we've said this at least 5 times now, but it needs to be made based on all of the variables except for how impatient people are. They just need to learn how to take a deep breath and wait for a minute while you assess this person and make a good decision, because it's really harmful for them if they are really out of it and then they try to continue boating and get injured worse on the way down. That's just not helping matters.
Yes.
Yeah. And want to say anything about next?
Not too much. Generally, the first responder stuff is pretty adequate for checking necks.
Yeah.
The only thing I would add on that is if you've had a head hit on the river, by the time you get, okay, don't think you can paddle it off. Give yourself time, like Teresa said, absolutely give yourself time. Walking out is always an option, and with any boater group that I go with, that's always an option anyway. On 3-day canyon kind of things, that would be pretty darn hard. So you got to take that into consideration. But as far as spinal injuries, the compounding with head injuries is usually when you start to feel it after you get off the river and you're in the car and you're going like this to your neck, going, ow. You're finally relaxing at the end of the day, you're dropping your shoulders, and you just notice that, oh man, there's something wrong. There's a that people will notice things after time too. So if someone's had a especially hard hit, don't just think it in terms of the immediate addressal, but also watch for when people are taking off the river and have some concern then too.
Sure. And someone made the point in the chat that after her TBI, she didn't really have symptoms until she was driving home after the trip. And so don't leave someone alone to drive home by themselves after a head hit. The swelling could increase for a day or even 2 days after the injury. And so the symptoms can continue to get worse, and they really need to be assessed. If they're basically, if a person hits their head and they're getting worse, they need to go straight to medical support. And if they hit their head and they're getting better, then you can do watchful waiting. But the watchful part is important. You have to stay with them and watch them.
I personally, if someone in my group had a head injury, I would not let them drive home alone at all. Just as a, just no, that's something I wouldn't even let go. A lot of people will say, oh, it's the common thing with head injuries that I've come in contact with and how I treated myself is that, oh, it's just a head hit, it'll go away. And yeah, you can make it. You can survive to the end of the river. You can survive the ride home. But by ignoring yourself, you can be compounding things for later. Yeah. No, I think most, that's, other than the spine or neck thing, more people on first responders are in the know for what happens on a broken neck or something than they are for TBIs, in my experience.
Well, broken neck is backboarding, right?
Well, they're more apt to just shrug off the head hit by going, it's a head hit, you'll recover, get back on the horse. That's just not the way to do it.
Are we going backwards or forwards? Let's go forwards.
Let's go forwards. This is something we were just discussing.
Yeah, we've done this. Oh, dickhead is a good one, though.
Oh, yes, explain that one. I did not know that one.
That's from football. Yeah, disoriented, irritable, combative, and comatose. So it's just an acronym to help you remember how people get when they've been hit. And in football, they didn't really consider it a bad injury unless they were comatose. But I think we boaters are smarter than that, and we can stop just at the disoriented and irritable stage and start getting help instead of waiting until they become combative or comatose. But it's true, people with head hits can be feisty. They can be like, no, you're not backboarding me, and I'm going out of here and I'm driving myself. They can be very difficult to control. So you have to be prepared for that as well.
Yes, and usually if someone has had a head hit and they're having a headache, they don't want to even acknowledge the injury a lot or quite often. That's why there's a thing through the Stroke Association in the UK. Ask twice.
5 times.
Or 5 times, yes. But they had an advertising thing that's really cool on YouTube that don't just ask your mate being your friend once about a problem. Ask them twice, because usually if you ask twice, you'll get the answer that is the problem.
Mhm. Yeah, and the memory loss thing is real. Did you have that experience, Oren?
I did not. I did not pass out on any of my head injuries. On any of them. I never passed out.
Mhm. Me neither. I haven't had loss of consciousness, but I have had memory loss where I got beat down in a rapid one day, and the next day someone asked me, "What did you do yesterday?" And I couldn't remember.
Yeah, there was one time on I think it was the Upper Gully. I was with some friends, and that one, I was really glad the person I was doing the commute with that week was my friend Sarah, who was also a doctor. She made sure I did not drive home alone. I rode home with her.
Mm. Did you vomit after any of your head hits?
No.
No. I have one friend who hit his head pretty bad on the Green Narrows back in the day when they were exploring it, and he immediately vomited, and then he kept vomiting. And that's also a bad sign. That's a 911 call if somebody vomits more than once.
Yeah, they're walking off. They're not holding down by
Yeah,
any.
they're or getting a helicopter.
Yeah.
Yeah.
Um, I do have I do have some friends, as far as the memory loss, that have no recollection of their injury,
Mhm.
of their getting hit by a car when they were on a bike, other than they picked themselves out of the ditch and hitchhiked home.
Oh my.
Um, yeah, one of my friends in California, her husband got hit by a car or had a stroke while he was riding, went into a ditch where he later gained consciousness and hitchhiked with the remnants of his bike home. To this day, he still does not know what happened. He can't recall it. And with that comes also the shame that you don't remember. You might be making something up. One of my another kayaking friend was working on his plane and went into the prop. Um, he lost most of his right lobe. But he does not, he said he's very glad he does not remember that. He said he woke up, he was in the hangar doing some maintenance, and he said, I remember being in the hospital.
Mhm.
And um, I have a friend who is in the army and is on the podcast I gave a link to later, and he had a shot to the head, which damaged almost the whole half of his brain with piercing. Um, he said once he woke up, he didn't think anything was wrong. He's just going, he couldn't talk, but hey, give me a gun, get me back out there.
Huh.
Even
Oren,
though, yeah,
we're an hour in,
okay,
so yeah.
I'm I'm gonna get
Haven't gotten to the helmets yet.
okay,
Helmet part.
okay. We were just caught going through this.
Yeah, we've done a lot of these
Uh,
things. Uh, I would say take a screenshot.
oh, did you want a screenshot?
No, that's okay. We'll share it again later.
Okay. Any questions before we get to the nice debatables?
I want to hear about helmets. Go.
Yes, we're gonna go over helmets. This is something I want to piss people off on. Not intentionally, but because of my recreational history, I was an early adopter of bike helmets. Bike helmets have changed a lot, and I've noticed a lot of their evolution is done not necessarily through science, but through marketing. Um, so I'm taking that into consideration in this part of the talk. Um, were you wearing a helmet? Please, as I said before, helmets do not prevent TIAs. They just decrease it. They don't prevent things. So
Got it.
This is an early bike helmet. We called it the leather hairnet. It was just leather with cushioning material in it. Um, and people were using these in the Tour de France well after the Bell Biker helmet came out. This is the first helmet I used on a bike. I was the first person in my whole northern Michigan to be wearing this in the late 70s. I wore this, and it made me feel like I was invincible. That's one of those perceptions you get when you're put on a helmet. Oh, I'm invincible. I can bash things. Well, no, bad thinking. But this is an early helmet. You can see pretty plastic with foam inside. This was an interesting thing on the evolution of bike helmets because this and that previous one came out at the same time. This is called the skid lid, which has the foam over here, but it had an open network, not just for air passage, but because the people that designed this knew that bikes were only going to be, bikers usually hit on the side of their head if they're falling. Even on a forward crash, they're going to be hitting their temporal area and sliding. So this was built to protect the impact areas, where the Bell Biker was basically just a piece of foam you stick on your head. So as we know now, I'm sticking with the bike helmets for a little bit, but with bike helmets, when I say they had the public perception of safety pushed bike helmets, because for a long time after the Bell Biker, this helmet was out, none of the professional bike riders were using these. They were using the hairnets. It took more than 10 years of general populace using these kind of bike helmets before the professionals even started wearing them in the '96 Olympics. And they were using those for aerodynamics more than crash protection. That's what they thought about them. They didn't, biking doesn't get too many head-on head crash injuries. That's the other thing. You can see how things have changed now, because now if you have a parent with a kid, your kid goes out without a bike helmet, you chastise them. Or most people do now. They consider it a safety thing on using a bike, even though head injuries are not really that common on bicycles. Slides, yes. But most people say if you're hit by a car, a helmet's not going to do much for you. You have other things to think of. But we've had a public perception of safety because, as I said, when I was wearing the helmet, I felt safe. I felt safer. And so the marketing went onto that. And now you see helmets on just about every sport. I mean, this is a good thing, but it's been the thing that drives it. I don't think I added the one on, this is an early plastic bucket for kayaking. Layer of foam, layer of plastic. This is the one I started with. It's basically a hard hat insides tied to a plastic bucket. These are new ones like WRSI has. I know we're both waiting to get to this one. Yes, you've got the newer one. ProTech, the ProTech Ace is an excellent helmet now, where they used to be those plastic Icks, but ProTech now makes a really good helmet. So does WRSI. Smith. Okay. I know we had a talk here from a guy from Sweet, and I'll be saying something that probably will not be happy with that.
No, say what you really think. It's okay.
Yeah, I will. I wanted to get to this slide because this is their example. Now, when kayakers get into the NAR boating and stuff, they think in terms of marketing, not in terms of safety. When you look at this helmet, this is like a helmet you would see on a motorcycle.
Mhm.
The problems you see with this is it will not let you tuck tight because this is going to be hitting your chest before anything else. You
Mhm.
get a tighter tuck without this. When you're going creaking, how many times are you hitting this? Most of your hits come from here or to the side, over on the sides. This back area or here. Nothing's going to come up here. Also, this thing, early ones were worse and they're getting better. But as I discussed with Teresa, this also gives the kayaker increased swing weights.
Mhm. It's heavy helmet.
When you go over a waterfall, you surf, you're swinging a lot more extra weight on your head with these. And for what protection? They'll argue that this increases protection. But is it meaningful protection? I would say no, because coming from an aspect of where I had a dislocated jaw and I was still going boating, I used Oren's helmet that he was recommending at the time instead of this design. And this is a company called Gath out of Australia, which uses a different kind of testing. They use different standards. They use different materials, and they have a different philosophy on their designs. The one Oren used, and I also used, looks like this. A slide down visor. Mine was a slightly different design, but notice it doesn't even cover, it basically comes down to your chin level, but slides down. This allows you to talk at a normal level so you don't have a rebounding device in front of your mouth because you can't hear people in the suite designs. People think, oh, the visor gets in the way. I never had anything hit the visor until I was doing something stupid on a really shallow gravel beach. It doesn't scoop up water to make it harder to roll or anything like that. And if you're concerned at all about facial protection, this is the kind of design that I like. It gave protection on the jaw. It gave frontal impact thing. It lets you tuck better and it lets you speak better. So that's why I like this design. I also liked the way they, part of the thing I worked on through work was I did a little bit of work with standardizations and stuff. And that skid lid helmet for bikes that came out with the Bell Biker, they both claimed better standardizations. The skid lid one had one with it hits to the side, and the one for the Bell Biker had a drop down test. The suites and a lot of the standardized helmets in the US use that fall down weight on the top as part of their standardizations. They'll also do side hits. But those hits are in a standardized area so you can fix your deformation. But is it realistic? The Virginia University test that came out a couple of years ago, 3 to 4 years ago, they raised this same question where they're going, don't we need a more realistic standard? And all hell broke loose on this. The helmet designers were going, oh, these guys are full of BS and crap and man. Well, and in the worlds of standardization, they had a very, very good comment to make on it. They got trashed by their boating community a little bit. They said, oh, you're not thinking in terms of the thing, but in terms of the standardized tests, the Virginia study used, to my mind, a more realistic protocol than the heavy drop weight testing. This I'm including is because when you think of a jet pilot, why is a jet pilot wearing a helmet? Are they going to hit their head much except when they eject?
Hope not.
So when you're looking at helmet design, think in terms of what you will need the actual protection from versus this design sort of goes along the principles a lot. And I'm don't really mean to drag into shred ready. It's mainly to the design. This design fails because of people's perception of motorcycle helmets. They want that, oh, it's got extra protection. Really? Does it have extra protection where it counts? As far as where it counts as well, these are my two favorite helmets. But there's now two different manufacturing methods for working with new tech for helmets. One's called MIPS. This is, I don't know what the acronym totally stands for, but I've got a link to it in my link page. They've been using this in bike helmets and motorcycle helmets and snowboard helmets. My snowboard helmets used this. And I noticed when I got the MIPS helmet and I was using my mouth guard, I do a fall backwards and it literally felt like I had hands on the back of my head when I fell backwards, just cushioning. It was awesome.
Wow.
It hits the mechanism. It's got a low friction layer and an outside shell. You can see on their website, I've got a picture. It's got a shell within a shell with the inner one able to move. The inner one hugs, but it allows the outer shell to do some movement. So it's a way of absorbing that transverse energy when your head hits something, especially if it hits it at a slightly odd angle, which is really big in snowboarding and bicycling stuff.
And as I understand it, it's that the rotational energy is what really hurts the brain.
Correct.
Very damaging.
Yeah, their studies that they used on MIPS was actually quite readable and understanding. So that's why I included the link to this. So you can check it out and actually read some of their study. You can go into PubMed and check peer reviews of it. The other thing that I've also seen for new technology, a thing called wave cell, which to me, it has extraordinary claims, meaning they're not realistic. I think they're using some made up statistics, but it's a material that will deform at different speeds. The wave cell, I'm not really sold on. It looks like a marketing thing. I haven't seen anything in the searchable things. Another one Oren's using for his current snowboard helmet. It's made out of one of those materials that will actually, when there's a concussion in the material, it firms up and then it dissipates. I included that as for the, what is it? I put it in the links. It's anti-ordinary helmets. That's what it is. There's a link to that. Something like that sounds like it would be very good for whitewater use. But with the community size of the whitewater boating community now, we're not going to see a lot of, we might see MIPS, but it's going to be a while before we see any integration of the new absorption materials because we're a smaller group of consumers.
There's a question, Oren.
Yes.
there's a study rating helmets from Virginia Tech, and they
Correct.
put a link to it. Are you familiar with it?
Somewhat. I haven't read it lately, but I read it when it came out.
Okay. I don't have a comment. I haven't read it yet, but I just took the link. Thanks for sharing.
Yeah, I've got a link for that in my link list as well.
Okay. And Oren, everybody has access to that. I shared the link earlier.
Good, because does anyone have any questions on helmets? Because I want to move on to just what to do as far as aftercare and what whitewater people can do beyond helmets and mouth guards. This is
Yeah, let's move on.
any questions?
Nope.
Cool. I've been discussing this a little bit with Teresa. This is if you're safety minded and want a quick and easy class that you can do actually through the computer, I highly recommend this class. It's called Mental Health First Aid. It's very easy. It's basically how to give yourself bolstering to if you view something traumatic, it gives you some tools on how to talk it out. The thing I like best about this mental health first aid is it introduces people to okay, I'm going to break because my mind's going. When you get a traumatic injury of any kind, you'll find out the hardest thing about recovery is that the victim often does not know the vocabulary for recovery. Recovery, people in recovery have to learn a vocabulary for their doctors to understand them, basically, and for their families to understand what they're going through. The mental health first aid it's made to develop the ability to ask awkward questions, how to check on people without being naggy, how to genuinely inquire about someone's health without tripping any wires, just to show concern. I like this program because it helps people with that hard part about after an injury. You want to be able to talk about it, and then you don't want to be able to talk about it because it gets exhausting trying to explain it to everyone, which is one of the reasons why I'm giving this talk, so people can understand that. The mental health first aid, it's only 10 or 15 bucks if you have to pay anything at all. You can usually contact your local community mental health office. Every county in the US has one. And quite often they'll have this training for either free or for 10, 15 bucks. It's money well spent because it's cheap. It does teach a little bit of that feely well-being kind of stuff, but you need it.
I've heard from other people in other settings about how good this training is. So, yeah.
It's cheap, it's good, it's quick. We also included it in suicide prevention or recognition. If someone you have a care for is feeling suicidal, how do you ask them about it? It's the same kind of mechanism. If you're boating with someone and they have a head injury, how do you talk about it without you having the experience of massive head injury?
Right.
It's to help get the dialogue going, basically.
Yeah. And help people be bold, because it does take some guts to ask those tough questions.
Really hard. It's like anyone who's gone through psychotherapy will know this quote by me, because I can recognize when someone's been through therapy because I've been in therapy myself without question. It's how the people talk and how they address things. And there's such a stigma associated with head injuries, mental health, that people naturally try to avoid it due to the stigma. This is a way to break through and say, oh, you had a head injury. That sucks. What can we do? Notice I included a we.
Mhm.
You make that genuine. If you're boating with someone and they have an injury of some kind, because I'm thinking in terms of maybe something happened on that trip that you didn't even notice. It might not even be a head injury. But say that friend that you used to go boating with is now totally out of it. How many people in this group have gone to one of those people who are sort of fading out? Have you asked why they're fading out? It might be important. That's hard. That's really hard, both on the person asking and the person getting asked. This mental health first aid is a way to get meaningful dialogues through better, which is why I recommend that. To me, it was money well spent.
Thanks.
Yes. And I put, since we're all into river rescue training, this will also help the talk with the families afterwards in case there's a death, the other kind of things that normally go with a trip, or the people who've been boating a long time generally know someone who's had a fatal drowning, or I've known more people that have fallen out of kayaking than in kayaking now. It's how to approach your communications. The other thing I will absolutely say from the handouts is this is a PDF. I've given a link to this. It's a traumatic brain injury survival guide. Read this, please. It's well, if you like it, he'd like some money because he wrote this, but there's no cost to download this. It's by Dr. Glenn Johnson, who is in Traverse City, Michigan. He's a friend of my neuropsychologist. A neuropsychologist is a really big, important physician in your healing group. If you read this, it will tell you what to expect for the person going through and what the family can expect. This will give you some familiarity with what's going on with the person and what you can expect. And if something's going wrong, you'll have the person having the issues will know something's going wrong, but what to do about it. This gives an explanation of what to do about it. I highly recommend this as well. Consider it a safety guide for everyone.
Mm-hmm. Yeah, I think it's a good read. I've only read a little bit, but
Yeah.
looking forward to it.
Same thing. We went over this
Not in detail, though.
detail, but yeah, you want to go through this one?
Sure. I mean, this is just sort of basic self-care. Like you bump your own head, what are you going to do? Well, first of all, get someone to drive for you, take a day off of work, turn off all the screens, avoid screens if you can. Don't watch TV, don't spend time on your phone, just close your eyes. And then get yourself to a doctor or someone who can check you to make sure that you're not going to have a stroke, that your neck isn't broken, you're not going to like immediately have severe problems. Don't take NSAIDs. Instead, use Tylenol for the headache and just kind of limit your excitement and exposure. Definitely don't rattle your head. Don't do anything that causes a lot of bouncing or shaking. You probably will find yourself sensitive to loud noises and bright lights, and so just don't be around them.
No thrash metal.
Yep, and just rest. And this last bit, journal your symptoms because you may not remember. It really helps a lot just to make a note. Here's the date, and here's what happened on this date. Here's the date, here's what happened on that day. And that way, when you do go to the doctor and they say, well, okay, like you might go back 2 weeks later or 2 years later, and they'll say, what happened? This way you'll be able to tell them.
Yes, and that also gives you a truth and remembrance, because after my car hit, I had immediate nasty, nasty, nasty headache. And I was just taking ibuprofen because I didn't know that you were supposed to take just acetaminophen. And I know from one of my friends who worked in pharmacy that the maximum daily dose that you should ever put in your body is up to 3,600 milligrams of ibuprofen. And when I journaled how much, I thought I was only taking like 4 pills in the morning, 4 pills in the evening. I was actually taking close to 3,000 milligrams worth per day after
Ooh,
my accident.
yeah.
And it wasn't even denting things after a while.
Mm-hmm. And it was increasing your risk of a bleed.
Correct. It
Yeah.
was something stupid I was doing that I didn't know better.
So Irene made the comment that you should avoid rolling after a suspected concussion. And I'm curious as to why you say that, Irene.
Mm, a lot of people end up with hypersensitivity to motion.
Mhm.
And so my head movements, there's no way I would risk turning my head, even going to a doctor and having them do like the Epley maneuvers.
Yes.
Totally incapacitates me for a week.
Oh, no.
Yeah.
Yeah, something's definitely off.
So any kind of rotational, you don't know what kind of damage you've got in your head,
Correct.
you
Yeah.
know, when you first hit on the river. So yes, roll if you capsize, roll, but if preferably, I would say don't be fooling around and rolling just for the fun of it.
Right. Makes
And
sense. Thank you.
yeah, if you've had a head injury or a head hit, rolling around would also throws off your sense of balance. So that would be that would fall in the evaluation port that they're getting dizzy.
Yeah,
Or,
it's a strong centrifugal
yes,
force.
correct. Yeah, I've had short periods where that's affected me as well.
What's the next slide?
Um,
Uh,
the big thing on this knowledge, will use this knowledge to help improve your risk analysis for both your group and your boating areas. This is one both you and I wrote. My big thing was all brain injuries are independent of each other. Each TBI is its own. Even though a lot of them are similar, people are going to respond differently. That's almost that's a rule. Things are going to happen to that person in a different fashion. When I had my first skull fracture, I went to a brain injury group, a support group. I got hit in the occipital area. That's when I fell onto the cement. Another guy had the same injury in almost the exact same area, and he was in a wheelchair. Um, and you can't really do a comparison of one person versus another, or your experience versus another person's experience. It's all going to be different. You just watch out for the symptoms.
yeah. I do think that second one in the list about cumulative hits mattering has been something I have seen in my own life. My
Yeah.
first several head hits had no real impact on my life. But then I had one that didn't seem that bad. It was a bike wreck where I went over the handlebars going maybe 25 or 30 miles an hour.
Hey,
Yeah, but I didn't really land on my head. I did a pretty good roll, but still there was an impact. But I was depressed for 2 years afterwards.
yes.
That was the first time that I was like, oh, this is, I need to be careful about this. And then I had more hits later that had even worse aftermath. So the first time you get hit, you might think it's no big deal, but I think it matters even the first time. And so I think for boaters, part of the risk analysis is to realize that every time you get hit, it increases the risk of a future problem. And so you should avoid hitting your head.
And one of my friends, who's a psychiatrist, very well known, that I go boating with, or used to before he stopped, he was like most boaters I know. He had his shoulder replaced, and he got his other shoulder replaced. And then because he went back to going back to boating right afterwards, he had to get the other one replaced again. He was just pushing the recovery envelope, saying, "Oh, I'm feeling great. Let's go out."
Mm-hmm.
Too many people that have had head hits go, I'm over the one, just like you said. Or like, I got over it last time. People are afraid to admit to head injuries. Just
Sure.
as much as they're afraid to admit to a shoulder injury, going, I can get out there and do it lightly. Yeah, right.
Let's keep going, Oren. We're going really long.
Sorry. With caregivers, discuss this with friends, family. Do a follow-up on any kind of traumatic experience in your boater group. Do some follow-up if you're the leader or if you're the best friend.
Mm-hmm.
Caregivers, the family, like to know if you get them in the loop before they need to be in the loop, basically. That's another communications thing. We talked over this. This is a recurrence. What boaters can do: respect the head injury, don't be ashamed of it, know the signs of a stroke, face, eyes, arms, that
Mm-hmm.
quick response. Signs of a TBI, basically you'll be doing the same signs as a stroke, but just give yourself time, slow down, know what to do. That's your safety in your group. Get help if you need it. This is one you wanted to go over because I don't
Oh,
have
it's
my
just a few
experience.
notes.
This is through my endocrinologist, which is all blood chemistry.
Nice. Yeah, I mean, these are a few odds and ends from my TBI protocol. I'm a naturopathic doctor, and there's an immediate need after a brain injury for glucose and oxygen. The brain needs oxygen. The brain needs glucose. But that doesn't mean you should go eat a lot of sugar. It's pretty important to eat only small and healthy meals immediately after a brain bump. And your body needs magnesium, and your brain has an increased need for magnesium after head hit. So that's a pill that you might have in the house that might help your brain. You should not drink alcohol. The third point about omega-3 fatty acids, so that's fish oil. Omega-3 fatty acids are what keep our cell membranes flexible. And if you eat a lot of fish or take fish oil in your daily life, then that makes your membranes more flexible in your brain, which could conceivably prevent a brain injury. And so in my prevention protocol, it's have lots of omega-3s on board before you ever hit your head the first time, and maybe it'll keep you from getting injured. And then the military has figured out that high doses of fish oil after a brain injury helps people recover. And they're mostly dealing with blast injuries in the military. And they take very high doses, 5 to 10 grams a day. That's a lot of fish oil. Some of them go higher than that. Antioxidants is like the things that squelch inflammation, like brightly colored fruits and vegetables have lots of them in there. They're usually related with the pigments in food. And so keeping lots of those in your body will help keep your brain from being overly inflamed afterward, which is what causes the long-term problems. There's a bunch of herbs. And this last point, avoid large meals. Not quite fasting, but very careful light eating is definitely beneficial for a person with a brain injury.
The same amount, like 3 times a day, or are you snacking?
Well, I would do intermittent fasting. I would have long time periods when you were not eating, and then have very good healthy food during the times when you are eating, and that would help keep your metabolism balanced. You don't want your blood sugar or your insulin going too high.
And for the herbs, there is one to avoid, especially with brain injuries. Um, I
Which
studied
one?
one of my minor studies with ethnobotany.
Mhm.
Avoid St. John's wort.
Yeah, I have that in my notes too. Yeah.
Do not ever take St. John's wort for any kind of potential head injury. Just it. The reason I'll say that is because the oxalates will totally screw up any prescription drugs you're taking. It's highly interactive and will mess up any prescription drugs you're taking for anything. So
Interesting.
that's why you want to avoid St. John's wort.
That's not the reason why in my notes, but it's interesting. Yeah.
Yeah, it's
Say avoid St. John's wort. The Latin name is Hypericum perfoliatum. Don't
yeah.
take that one.
A lot of stores will sell teas with it. Avoid it because that's one to avoid if you've had any head injury at all. Um,
Okay, let's do the next one. We'll get
uh,
to.
yeah, this is just going on our discussion. Um, this is just okay.
It's obvious, is what it is.
Obvious. I just added the section on repetitive head actions and subconcussions. Don't think of your helmet as your only base of protection. Um, it's not a TBI protection. It's a energy dissipating device. um,
Mm.
Try to get an additional layer of protection by using a mouth guard because you can. They're not uncomfortable to wear because waterfalls, side surfing, the bumpy stuff, that all has a toll itself. And so it's not just everything that's impacting your helmet. Uh, these are just some rehab stuff I've had in the past. The Slow Road to Better podcast at the bottom, I highly recommend checking it out because it's hosted by some people who cannot talk as well as I can. And it's pretty good. Some of their past issues have gone over a really good amount of neuro stuff that's fun to know. Oh yes, and the
Great.
final thing that I want to add about TBIs as
Yeah.
well. If you're thinking in terms of just TBIs and in that, realize that if you've ever had one TBI, you instantly get kicked into the percentile for you have just with one TBI, you have an 80% chance of getting epilepsy in the future. It's sort of rolling the dice of when or if, but you get a much higher percentage chance of getting epilepsy or seizures in your life, usually hitting you after your 60s.
Great.
So late onset seizure stuff. And do a chronology, do a journal of any head hits because one, they'll help you in the future in case anything more comes along. And two, a lot of this trauma stuff also impacts other health issues as people get older, like Parkinson's or the one that starts with an A, or with me,
Alzheimer.
yeah, or with me, it gave me both ADHD aspects and autism elements in my head that I now have to, oh, and anxiety. I never had to worry about anxiety until after the car crash. And I'm going, what the hell am I at? Yeah. Anxiety is not something you can really plan for. And that's what we got.
Yeah, it's wonderful. Thank you so much, Oren.
Sorry if it went long.